The study that we presented an abstract and also a poster this morning is on the anti-angiogenic effects of 2,3-dimethylcelecoxib, or I'll call it DMC. The focus of the studies are on gliomas. Gliomas are brain tumors, very highly vascular. And at this moment, there is very little, in the past 10 to 15 years, very little major advance in treatment of gliomas. As you probably know, that from the time of diagnosis, 8 to 12 months, we find that the glioma is fatal. Also, we know that blood vessels are very critical for glioma cell growth. The blood vessels, of course, are responsible for nutrients and oxygen to the tumor. So work has shown that anti-angiogenic therapy may have some relevance to the destruction of gliomas. The major treatment for gliomas at this time is temozolomide or Timodar. And we know from our studies that temozolomide has an intense effect on the glioma cells. However, it does not affect the vasculature. So our question is, can we find a drug that will affect both the tumor cells and the vasculature? Dimethylcelecoxib is an analog of celecoxib. Celecoxib, this analog, however, does not have COX-2 inhibition. And we're familiar with COX-2 inhibitors, for example, Vioxx and Celebrex. What we know about these COX-2 inhibitors is that they have potential cardiovascular problems. So the point about using 2,3-dimethylcelecoxib is that DMC does not have the COX-2 inhibitor and therefore the side effects of COX-2 inhibitor. So when we know that DMC has an effect on the glioma cells, it causes the glioma cell cytotoxicity. And so our question was, does DMC have an effect on the blood vessels? Is it also an anti-angiogenic activity? And we found that yes, DMC causes cytotoxicity of the tumor vasculature, not the normal vasculature. DMC causes blocking of the blood vessel proliferation, of blood vessel migration. So it is a very effective anti-angiogenic therapy. So, and targeted to the tumor vessels, not the normal. So the conclusion is that DMC has several important aspects. One, it is not a COX-2 inhibitor, so it doesn't have the cardiovascular side effects. Two, it blocks both it inhibits both tumor cells and tumor blood vessels. So you have one drug that attacks both aspects of the tumor. And since it doesn't have the bad side effects of COX-2 inhibitor, it can be used over the long term, which may be used now in cancer therapy. And the other important point is that we know that highly vascular tumors are present in other kinds of tumors, and so this therapy could be used for other tumors as well as gliomas. Thank you.